Hi, my name is James E. Clark, the 12th President of South Carolina State University, and you're watching the Orangeburg Television Network.
Hello, everyone. I'm Paul Harris here at the Mabry Cancer Center, part of the Regional Medical Center here in Orangeburg, South Carolina. This is a spinoff, Medical Moments of New Perspectives, also found on our Orangeburg County Television Network and OrangeburgCountyTV.com. Today, I am here with Thomas Key, who is a high-risk OB here at the Regional Medical Center, the first that they have ever had. Mr. Key, Dr. Key, welcome to the show.
Thank you very much.
And before we get into a little bit of OB stuff, you spent 25 years in Montana.
You know, I did. I spent 13 years at the University of California, San Diego on faculty. Prior to going to Montana, I was the first high-risk pregnancy specialist in the state. Montana is a very large state. There are very few urban centers, and they had a tremendous need. When I arrived in Montana, most of the complicated OB was going to Salt Lake City, to Denver, to Seattle, and Portland. And my task, my mission there was to change that and try to keep as many mothers and babies at home that we could. And we did.
Okay. So what made you come back to Orangeburg, South Carolina?
You know, I tried to retire, Paul.
Okay.
And I just really couldn't do it. And I have ties back to here. My education was in Charleston. Medical school was there. Residency in obstetrics and gynecology was at Medical University of South Carolina. And I still have a lot of family in the South Carolina area.
And also, like I said, you were definitely needed here as being the first at-risk OB person here in the Regional Medical Center.
And what I hope that we're able to accomplish with this in a very, I think, soft and gentle way, and not to change medical practices that much, but to perhaps decrease the number of trips between Columbia and Charleston for women who are going outside the region for specialty care. I really think that we have the tools, the equipment, the personnel, the staff to be able to provide a lot of the care right here.
Now, share with our viewers and our listeners a little bit about OB, and also what's the difference between an OB and a gynecologist?
Well, obstetrics and gynecology is a specialty where physicians focus on women's health care. Obstetrics is the special field which relates to care for the pregnant woman. Gynecology relates to women's health care. It may be contraception. It can be well women's care. It can be maintenance preventative care, Paul.
Okay. So with being an OB, high risk at that, I'm pretty sure you do a lot of C-sections. Tell us a little bit about the process of a C-section for women that are possibly pregnant that could have a C-section in the future. Tell us a little bit about that process.
Well, you know, C-sections today nationwide occur in about 1/3 of all pregnancies. Very common. The indications and reasons for C-sections have expanded. I'm hopeful personally that the number of C-sections that are being performed has capped out. I really think that in most situations, vaginal birth is clearly preferred for many, many reasons. But C-section serves a very vital role for those who need it, for complicated situations with moms, for complicated situations for babies that are malpositioned, that they're trying to be born in the wrong direction and so forth. It is a very valuable procedure. But C-section basically is an abdominal surgery. And so instead of the infant being born through the birth canal or through the vagina, the baby is actually born through an abdominal incision.
Wow. And one thing you mentioned of the baby being turned the wrong way, that's something I've heard a lot. Is there a way to prevent that during pregnancy, or is it just something that randomly happens?
You know, about 3% of babies are malpositioned at birth.
Okay.
97% are head down. And usually the polarization of fetuses or infants occurs typically around 30 to 34 weeks. There is the capability today, very successfully and very safely, in those cases where babies are malpositioned, to actually physically be able to turn those children. And so the baby that's breached actually to bring them to a vertex or a head down position. The success rate for that in trained hands is about 80%. It's not 100%, but you reduce the C-section rate substantially in that population.
Now, being high-risk OB, what's one of the craziest things you have had to take on as an OB? I know you mentioned to me off camera about how back in the 80s where you ended up in New York on television because of a high-risk delivery.
Paul, I've always been very blessed in my career to take care of unusual patients. The truly the exotic, the oddities, the rarities, those who are very complicated. But the ones that come to mind would be the mother who had a cardiomyopathic condition. Her heart was failing in pregnancy. The only treatment that was available to her as a pregnant person was actually heart transplant. And I was a part of the team, I led the team that did the first heart transplant in a pregnant person. She was mid-pregnancy. She survived. And as a part of that, the patient and I, were actually taken to New York to meet with David Hartman.
Wow. So, ladies and gentlemen, you're watching and listening to a pretty famous man here in Orangeburg, South Carolina. We were able to bring him here as he's the first high-risk OB person here at the Regional Medical Center. And wow, that's a phenomenal story.
And then about 4 years ago, Paul, we had the opportunity to bring a young woman out of Calgary, Canada, into Great Falls, into my center, who had a set of identical quadruplets. And that is truly statistically an improbability. Quads are very infrequent. They occur about once in a million. Identical quads, meaning they all came from the same sperm and the same egg, reduces the prevalence to about 1 in 13 to 14 million. And we got a lot of news play, a lot of international media play from taking care of that one.
So that just so happened to be in your area at the time.
It was referred to us principally because of facility. The center in Calgary did not have the facilities to take care of 4 babies born at the same time. Obviously, they were going to be born early, and then for the special expertise to follow and monitor those children. A lot of things happen in identical pregnancies, be it twins, triplets, or quads.
Once again, we're here with Dr. Thomas Key, and this is a spinoff of Medical Moments for New Perspectives Media on OrangeburgCountyTV.com and also the Orangeburg County Television Network. And Doc, I know what your job is. You can be called in any time of the day. Tell us a little bit about that. Is it stressful? Do you enjoy it tremendously? Of course, I know you do, but it's a very busy job.
My job is very fulfilling. I don't think anyone could have a job that was more rewarding than mine. And to be involved in being able to maintain the health and well-being of a mother and a family and a child is extremely important. Making the right decisions at the right time, bringing in the care that's really necessary. I hope that we're able to have a very positive impact on this region, and I know that we'll be working in a very collegiate manner with my colleagues in Columbia as well as in Charleston.
Now, I know you deliver high-risk pregnancies. Are they seen before, do you consult women if they know they're possibly on the road to having a high-risk pregnancy?
Many of the women I take care of, Paul, are known about because of underlying diabetes or high blood pressure or past medical problems and experiences. Sometimes it's multiple pregnancies. We also take care of mothers who are carrying children who have congenital birth defects. Sometimes it's brain, spine, heart, gastrin, any birth defect. And so that's a very big part of what we do. And that will bring ultrasound as a diagnostic tool into focus as well. And we're hoping that we're able to add those programs in the months ahead. We plan to.
Now, I mentioned C-sections. Are there any other high-risk ways for a baby to be born that you have conducted?
No, Paul, I really think there are only 2 ways for a baby to be born.
No,
I can only imagine
I was making
2.
sure.
Right, and you can either be born naturally, vaginally, which, again, hopefully at least 75% of babies are being born vaginally. And then alternatively, as an option, in those cases where it's needed, an abdominal delivery or a C-section is very important.
Now, being from Charleston, South Carolina, going to school in Charleston, South Carolina, was this always a dream of yours to be an OB, but not a high-risk OB, but an OB in general?
You know, I've been very fortunate. I've been very blessed in my career. I've always been in the right place at the right time to make the right decisions. You know, there was a time where I never planned to be a physician. I was going to be a physicist. But be it as it may, it's been a series of fateful decisions that has landed me here. I'm very happy to be here.
Well, we're happy to have you here as well. Is there anything else you'd like to address to our listeners and also our viewers about your profession and how you save a lot of lives?
But, you know, one of the real, I think, goals that I have is not just taking care of patients, but also providing assistance to the physicians in this region.
Okay.
And that's a big part of what we do. It's not necessarily taking over the care of a patient, Paul, but rather collaborating, working with them, helping create a care plan which can be continued, oftentimes by the primary care physician, being an obstetrician or being a family medicine physician.
Also, I have to ask this one thing. One thing you also said off camera was your job is almost at night and always on weekends. How difficult is that to possibly have to wake up in the middle of the night to go treat someone?
Well, it's what I've done all my life. And again, for many, many years, I've practiced by myself. And that was 24/7. And, that will not be my situation here. I'll certainly be available for cases, and I will be a part of the rotating call system here at Regional Medical Center, and I'm very happy to. The call system I'm going to be a part of, believe me, is a lot better from where I came.
Okay. So that might have been another reason why you came to take this job as well, maybe.
Probably not, but that's okay. It's going to be one of the bonuses.
Yeah, nice little benefit as well.
Right.
Well, Dr. Thomas Key, we appreciate you for joining us here on New Perspectives Media. This
My
is
pleasure.
a spinoff of Medical
Anytime.
Moments. We were able to get you on camera and also radio as well. So
Thank you.
Once again, this has been New Perspectives, a spinoff with Medical Moments. I am Paul Harris, and I am signing off from the Regional Medical Center. Also a part of OrangeburgCountyTV.com and the Orangeburg County Television Network.
This has been a production of New Perspectives Media, a part of the People Station WOCS 93.7 FM, located at 1581 Russell Street, Orangeburg, South Carolina. New Perspectives Media is sponsored by Orangeburg Consolidated School District 5, Regional Medical Center, the Department of Public Utilities, Jimmy Jones Toyota of Orangeburg, National Kidney Foundation, Curry Insurance Agency, Dean Law Firm. For more information about upcoming programming, tune into 93.7 FM, The People Station.